This is a rare disease. See those stripes? In the white matter. These are characteristic imaging features which help us to make the diagnosis.
When an image of a child's brain shows an unusual shape or malformation, it could be a sign of disease. However, pinpointing and correctly diagnosing brain disorders is not always easy because each disease can show variability in different people.
So you see those are difference in image quality.
To help doctors better treat young patients, Dr. Thierry Huisman and Dr. Miller of Johns Hopkins are constructing a Google-like database of children's brain images.
We're building essentially a brain cloud, which is a large database of images, magnetic resonance images of children's brains.
Dr. Miller is the biomedical engineer responsible for developing the software that holds the brain bank. He says this database could help diagnose and predict pediatric brain diseases such as epilepsy and psychiatric disorders.
We'd like to be able to do data mining, just like you can do on the internet, and search for groups of patients that have common features in their imagery.
Dr. Huisman started collecting children's brain images in 1994 in Switzerland. Johns Hopkins paired him up with Dr. Miller to integrate his scans into a searchable program using a grant from the National Institutes of Health.
We are focusing on the imaging of the developing central nervous system of children, and we are covering every child between basically before they're being born. We start with the fetal time period, but for this particular data set, we start basically at the day of life, of the day of birth, up till the completion of the 18th year of life.
They currently have about 7,000 brain scans and are adding up to 100 brains a month to the database. The more images collected, the better.
The bigger the database, the more reliable we can use this database to identify diseases earlier, because the more data, the more you're including the variability of a disease.
Dr. Huisman's goal is to make the brain cloud available to the public in 3 years. The software works very similar to facial recognition technology. A doctor uploads their patient's brain images, then the computer searches the database for similar patterns and sends the doctor results for possible diagnoses.
There's many things in common with our Google search engine for brains, our ability to search on brain, with search engines on face.
The software takes thousands of images in 250 different regions of the brain. Using computational anatomy, a study Dr. Miller pioneered, the computer creates an index to compare brain scans.
Computational anatomy is attempting to understand the brain in its parts.
The brain library Hopkins is building could allow doctors around the world to more quickly and efficiently diagnose children's brain disorders. The works of Dr. Huisman and Miller are merging big data with medicine, something we've yet to see on this scale. They say it has the potential to revolutionize the industry. In Baltimore, Maryland, Perianne Boring, RT.